I can take off my mask. Asante sana. Hamjambo? Good afternoon. Adwake abu mulega. Asanteni sana. First of all, thank you very much, Governor, and thank you, my brother, CS Mutahi, and fellow colleagues from the ministry, health workers, and members of the Fourth Estate. Wananchi wapendwa, I'm delighted to be in your midst and to inform you that the national government appreciates the important role that every Kenyan has played and continues to play in combating this virus. As I have often stated, this is a disease that the government cannot fight without the support and cooperation of the people. It is a fight whose success is heavily dependent on active involvement of every Kenyan. I want to thank you for holding each other's hand, fighting together at the two levels of government. We must continue to cooperate if victory is to be realized nationally. Remember, coronavirus in one county is coronavirus in all counties. Being here in Kiambu is a continuation of visits by the Ministry of Health officials to counties to assess the level of preparedness and to determine the support needed to enhance readiness to combat this virus. Evaluating county readiness is of critical importance, considering that this disease is now within the communities. As I already mentioned, infections are growing within the counties. 32 out of the 47 counties, Kiambu included, have so far recorded cases of the disease. This number accounts for more than 60% of the counties affected. Kiambu County has recorded 39 cases, placing it at number 4, behind Nairobi at 835, Mombasa at 490, and Kajiado at 65. This, ladies and gentlemen, is a worrying trend, and we must collectively stop it by observing and practicing the containment measures that we continue to advocate for. We all know those measures. They include what we have just been doing: washing our hands, social distancing, and I can see some people not doing exactly that. But at least you have got your mask on, which is a good thing. These measures may sound very simple and therefore easy to ignore. But experience from elsewhere has shown that they are the most effective ways to tackle this virus. These measures must be complied with by all of us at all times, whether at the marketplace, whether in a garage, whether in a construction site, whether in a kiosk, whether in a shop, anywhere you are, you should be observing these measures. As the Ministry of Health, we will continue to work closely with the counties to provide support as appropriate in order to upscale county capacities. For instance, the ministry has facilitated the training of healthcare workers in every county. And Governor, I'm glad to hear about what has happened in Kiambu County. I witnessed the people who are going to be operating ventilators, and I can see they are trained, because a person using a ventilator who is not trained can end up being more dangerous than the disease itself. So, further, the ministry continues to provide personal protective gear and other commodities at various health facilities for use by our health workers. And I repeat and I keep repeating that our health workers are the most single important ingredient and factor in combating this disease. We cannot afford to have our health workers infected by the virus, and we are so happy that so far, so good. Please continue. Protect yourselves Na namuona hapa mkiwa wengi. Protect yourselves. First protect yourself, then protect others. Ni kama ndege. Kwanza uvae ile mask, alafu patia wengine wavae. Yes. Tuko pamoja hapo. So therefore, we will continue this support. And I want to say that as we deal with this health pandemic, as we deal with coronavirus, I think it is important for us also to appreciate that corona is not the only pandemic or disease that we are dealing with. It is also about other conditions that require different types of interventions. And I'm glad, Governor, the effort that you have made in Kiambu is absolutely admirable. Congratulations. Mkimpigia makofi ni sawa. Because the extensive arrangements you have made are going to be very, very important, not just for Kiambu County, but for Nairobi as well, and the environs, because we know that you cannot turn back a patient. And I'm aware, as you have explained to me, that you have quite a number of patients in Kiambu hospitals who actually come from Nairobi. Your maternities are good, so I'm sure you get quite a bit of population that comes from Nairobi. So keep up the good work. If they come here, they are registered here, they are voters here, so it's okay. But the main objective of these facilities is to ensure that our people remain healthy and remain in a situation, in a condition where they can be contributors to the economy rather than sick individuals. So this is the main objective of the universal health coverage is essentially that, is to keep our population healthy. And I want to say that we will be enhancing our UHC capacity. We will be building on UHC. We will be launching it everywhere. We are building the institutions that are necessary to make UHC possible. Those institutions include the National Hospital Insurance Fund, KEMSA, as well as other national organizations that are critical in the support for UHC. We have learned that there is need to strengthen primary health care at the community units, dispensaries, and health centers. And as you know, most of these are devolved functions. So we are quite glad, especially in Kiambu, about what you have done with primary health facilities. We continue to insist that the best cure for disease is prevention. If we can be able to prevent people from getting sick, and some of the measures that we have seen, hygiene measures that have been taken at county level, have contributed to reducing the incidences of disease across the country. And we would like to urge that some of these measures that we take, or we are taking because of COVID-19, should be sustained and maintained into the future so that they can be part of our way of life. Washing our hands, sanitizing ourselves. This is something that we should continue with, even post-COVID. Therefore, the idea of the primary health care... Sorry. Hii ni jua kali kidogo. Can you hear me? Okay. Is it necessary also? Where are those wakarabati? Is it necessary this one, or I can use one? Okay. So this is the fact of the primary healthcare facilities are critical and important. To improve capacities at the county level, I know that, as you have just said, you have been recruiting workers in the county. Hii sasa imewekwa sanitizer mpaka sijui kama itasikika. Asante. Thank you very much. Asante. I want to congratulate you on what you have done, Governor, as far as recruitment is concerned. Because let us not forget, when we hear that health workers have been recruited, what we are essentially saying is that somebody has got a job. And that's always a good thing. That is one more family that is going to benefit as a result of both county and national government effort. And our job is to balance between ensuring that health is number one, but also we would like to create opportunities for people to work so that young people are able to exercise and carry out what they have learned rather than stay at home. An additional 100 health workers in 14 cadres are also expected to be recruited by your county service board. I would like to appeal to the county through the governor for this recruitment process of the remaining healthcare workers to be expedited so that people in Kiambu can benefit from these services. At the community level, 1,171 out of 1,200 healthcare workers have been sensitized in UHC, which includes COVID-19. All this to boost the county's health workforce. Fellow Kenyans, we are working towards ensuring that the county has essential medicines in its health facilities. Therefore, under UHC, Kiambu has been allocated some 216 million shillings this financial year. And the medicines are undergoing final stages of being dispatched. I encourage the county to place its next order and set up the Medicine Therapeutic Committee, which will help in quantifying the needs of the future. The allocations are to supplement the county's budget on medicines. I encourage the county to spend its budget on essential medicines as well. We are also planning to place basic equipment in the facilities in the next financial year so that the basic tests, such as emergency care for pregnant women, can be performed. I want to thank the Kiambu County once again for the effort it has put in UHC so far. They have even gone on to put in even delivery facilities within a COVID unit. I am informed by the DG for Health that in a maternity, the required PPEs would be as high as 15. Is that correct? Yes. As high as 15 for one delivery and for one case only. So you can see the needs for the personal protection, that equipment that we have been advocating for and we have been delivering. We have learned from the counties that have implemented UHC successfully that their economies have grown, their citizens are living longer and have a good quality of life. In Kenya, we can achieve this with the plans we are putting in place, which require individual cooperation. We will not want to wait to get sick, but instead engage in activities, health activities such as healthy eating, exercising, and adopting appropriate health-seeking behavior. Further, the government's agenda is to make healthcare more affordable so that the common mwananchi does not have to suffer. And this is a promise that the President has made, and this is something he has asked us to make sure is done. And to achieve this, we have embarked on reforming our institutions, as I had said earlier. And I want to appeal to Kenyans to register with NHIF so that they can be able to carry out the work of ensuring and assuring you that when you fall sick, you are taken care of. At the same time, we will continue to encourage our people to visit our health facilities. Do not let somebody die at home because of fear. Do not let somebody who looks sick stay at home, because somebody who dies at home with COVID-19 then can infect a lot of other people. And this disease is not a joke. As I told you yesterday, the more we test, the higher the number of positive cases that we are likely to get. Today, 147 people have tested positive out of 2,831 samples now tested. This means that Kenya now has 1,618 people who have now tested positive. The cumulative test conducted so far is 70,172. And in terms of age distribution, the youngest is a 1-year-old infant, while the oldest is 87. These cases are spread across the country, 90 in Nairobi, 41 in Mombasa, Kiambu has another 3, and so on and so forth. We have also got now counties that have got cases that didn't have before. Nyeri has joined with 2, Uasin Gishu has 2, while Kajiado, Kilifi, Embu, Homa Bay, Murang'a, and Machakos all have at least 1 each. The distribution in Nairobi is as follows. Kebra, 35 persons. Langata, 15, and that's near Kibera as well. Makadara has 9, Westlands has 8, Embakasi Central has 6, Embakasi West has 5, Kamukunji has 2, Mathare an additional 1. You recall that yesterday we had 33 from Mathare. The reason why there is 1 is because we have contact traced and gotten all those people. And these people that we are mentioning here are sourced from different places. Some of them are in our quarantine facilities. Some of them are people who our team, the contact testing cases, who place themselves in the various streets and are carrying out tests, are picking from. And the normal way of doing this is that as soon as we know that somebody is positive, they are telephoned immediately, they are told to self-isolate, and then our Ministry of Health officials and the county health officials then go and pick them up in ambulances and take them to isolation facilities. I would also like to urge that there should be no stigmatization of individuals who have tested positive. I have said and I repeat, there is not a single person who is safe from getting or becoming COVID positive. Anybody can get it. You can get it, I can get it. And we have said this over and over again. And that's why we emphasize that when somebody is positive, what they need from us is care, empathy. This is what we should be concerned with. And when they turn negative, then we'll welcome them and be happy and pray and thank God that that is what has happened. So out of the 147 cases that I mentioned, all of them are actually Kenyans. We don't have any foreigners out of them. 87 of them are men, while 60 of them are women. Men continue to get to positive cases in much, much larger numbers than women. But even with rising numbers, I'm also glad to inform you that today we have discharged 13 patients who have recovered from the disease, and we are always happy to hear that. So our total number of recoveries now stands at 421. On a sad note, however, we have lost 3 people from the disease. One of them in Kiambu County, in Thika, and 2 others in Mombasa. Both of the cases in Mombasa had underlying conditions. I want to pass my sincere condolences to the families and friends of the departed. May their souls rest in eternal peace. As I conclude, I want to inform you that today, May 28th, is the World's Menstrual Hygiene Day. To celebrate the day, whose theme is "It's Time for Action," we are launching our Menstrual Hygiene Policy and Strategy 2019 to 2024. This policy is meant to create an enabling environment for implementation of menstrual hygiene and management interventions in Kenya. It will also ensure that women and girls have access to safe and hygienic products. I'm delighted to inform you that Kenya is the first nation to develop a standalone menstrual hygiene policy through a multi-stakeholder, consultative, and inclusive process. We acknowledge the contribution of the stakeholders in developing this policy and strategy and in advancing the menstrual health and hygiene agenda in Kenya. Finally, I want to thank Kiambu Governor, Dr. James Nyoro, and all those people in Kiambu for their efforts in combating this disease. Due to your proximity to Nairobi, which is the most affected county at the moment, the number of infections would have been much higher had you not taken the measures that you have taken. And we want to encourage you to continue taking the same strict measures. The collaboration between the people of Kiambu and the county government have managed to limit the spread of the infections. And I want to say here that, as I have said, that this is not a disease that belongs to the county government of Kiambu. It is not a disease that belongs to the national government. It is not a disease that can be defeated by any government. This is a disease that can only be defeated by the collaboration of all of us together. And we would like to say, as we look forward, as we look at engaging more and more, opening some sectors of our economy, as we have done, for instance, with the hotels, I would like to say that the job of ensuring that the transmission is reduced will more and more be passed to individuals themselves. It is not enforcement agencies who are supposed to secure us. It is we as individuals who are supposed to secure each other. I said yesterday that the readiness of a county is commensurate with the cooperation between the county government, as in the county executive, the county legislators, as well as the citizens of each county. And therefore, it is clear to me that there has been that cooperation here. And, you know, there are always people who will criticize what we are doing. There are always people who are going to say, Governor, that you are not doing what is supposed to be done. My encouragement to you is keep your eyes on the ball, keep moving on. Let's just protect the people of Kiambu and the people of Kenya. We must not let our guard down. I thank you.